Hi, thank you for joining me. Today we're going to talk about network solutions for a self-funded benefit plan. Your network solution should be able to address where your membership should go for care and how much it will cost, not only the member, but also the plan. So when you choose a network solution for your self-funded benefit plan and you choose to work with a TPA, you generally have more flexibility in the network options that you have. But when you make those choices, that also includes a need to educate your consumers, your members, and their family members. So insurance cards very often have the logo of either the employer and or the TPA or the ASO. And then there's the PBM, your network, there's phone numbers, there's addresses for claims. And all of these things can be very confusing. So trying to educate your membership about what's on the ID card and what information that tells them will help them to get the most out of their benefit plan. You want to make sure that your members know when they're traveling and they need a doctor, where do they go for care? Do they just go anywhere, or do they have access to an out-of-network benefit where you might have a network solution in place that can save them additional funds than if they went out of network just to any physician? And for most day-to-day purposes, who is in network and how do I find a provider? So generally when we talk about network solutions, we're talking about in-network and out-of-network. An in-network option is usually, in a traditional sense, a network solution where a network has contracted with providers and facilities and they've offered to provide care and service at a reduced or contracted rate. And that rate will save the member money when they go to pay for those services. Out of network are providers who are not in that contracted network, and they are not responsible to only charge the member this negotiated rate. So they can bill full charges, or they can bill a variation of that amount for cash paying customers. So then when we talk about in-network and out-of-network, there's really kind of three traditional options. There's a national network, which generally costs a little bit more money, but within that, the network spans across the country. And that might be the right network solution for your plan if you have multiple locations across the country. So you need to accommodate a wide geography for your employees. Or perhaps your employees travel a lot and you want them to be able to have access to care at this discounted network rate wherever they go. Then there's a regional network, and those are generally very well known in a community, and it's great for smaller populations that are sort of restricted primarily to a regional area. And those tend to be very popular, but if you have membership that either travels for vacation or for business, you might want what we would call a wrap network. And that wrap network kind of does exactly that. It just sort of wraps around the regional network. And even though it's out of network, it captures some amount of savings for any out of network care. So if you have members on your plan who have college students, or they are snowbirds and they work remotely and they're in a different location for the winter months, where are they going to seek care in those situations and still save some amount of money? So a wrap network is good in those situations. But there are more options. And they're newer, but not totally new, but just another option to consider from something that we would consider very traditional in those national or regional network options. And that's direct primary care, or DPC, or reference-based pricing, or RBP. And both of them function very differently. If you think about direct primary care, or DPC, as sort of a regional network on a smaller scale, they're generally either a DPC organization on purpose, or it's maybe a group of physicians and facilities that are all kind of related and have agreed to, a certain arrangement with themselves, where you as the employer would pay a set monthly fee for every one of your members to have access to care, and their providers within this smaller group of primary care providers. And through that, your membership might go for zero copay cost for day-to-day care. So direct primary care arrangements exist across the country to differing degrees, but for a number of organizations that have tried this model, they have found great success with it. And then there's reference-based pricing, which is really unique because this model is a reference-based price off of Medicare. Generally, a percentage of Medicare is what you agree to pay providers. And you can use RBP as your primary network option as a full network replacement, which means your membership can see any physician, and traditionally you would engage with an RBP vendor who would help you to negotiate those savings and make those payments as the claims come in, so that there's not a balance bill option for your membership. Another way to use RBP is if you select a regional network. RBP might be a good option for you outside of the area when you have membership that travels for work or for leisure. RBP can replace that wrap network. So a wrap network might have a traditional PEPM fee associated with it that you would pay for everybody whether they use it or not. RBP can be a good option for some plans in addition to that regional network if you'd like a more traditional local option, but for travel, you could use RBP instead of a wrap network solution. It's also full network replacement. So when you decide which network you're evaluating, which sort of network option, traditional or sort of newer, could be a good fit for your employees, what you want to think about is your geographic area demographics, what your plan goals are, and what your company's appetite is for change. So when we think about geography, as I said before, are your employees sort of in one regional location? Do they travel a lot? Do you have multiple locations across your state or the country where you might need to get access for a number of different people in different places, and a national network solution or a full RBP solution might be a best option for you? So geography is really important. Then when we think about demographics, you want to understand how comfortable do you think your population will be with the network solution you're going to put in place. So if you want to try something different, are you prepared, or can you leverage the work of a TPA or ASO to help educate your employees so that they can understand what changes you're planning for your network solution? You also want to identify what is a priority for your benefit plan. So are you using your benefit plan as a tool for recruitment and retention where access to care is really critical? Or is it savings that's really important to you? You have to think about what it is that you want to achieve with your benefit plan, and some of that guidance will tell you what it is that you need to put in place. And then finally, your appetite for change. Within the company, when you're deciding what your benefit plan goals are, how risk averse is your organization? Are you willing to go for new ID cards and a different network solution and explain that to everybody? It can bring you great savings. You just need to be willing in that upfront to have the conversations with your leadership and with your employees about what those changes are. So let's just break it down. There's in-network and out-of-network, national, regional, wrap, and then direct primary care and reference-based pricing. All of these are a solution for network savings when you have a self-funded plan. There's a lot to think about and a lot deeper we can go, but at a very high level, I hope you found this informative, and I appreciate you spending some time with me. You can visit Nova's website at novahealthcare.com to get access to more resources. You can connect with us on LinkedIn or Twitter, and of course, you can check out our YouTube channel for additional videos. Thank you.